Hi everyone, it's Dr. Lindner. In this short video, we're going to be looking at the cranial nerves. When we do the cranial nerves, it's important to have in mind the names of the 12 pairs of cranial nerves, and not just the 12 pairs in terms of their names, but also be familiar with the cranial nerve number in terms of Roman numerals. So you'll see on this picture, you'll see, for example, optic nerve 2 or trigeminal nerve 5, facial nerve 7, vagal nerve 10, glossopharyngeal 9, abducens 6. So you want to be able to know them by name and Roman numeral. And there's a few ways of doing that. There's a simple mnemonic that I learned, and I'll share it with you. It's a clean version. But just here, looking at the inferior view, there's like three things that should stick out. To me, at least they do. It's this one here off the cerebrum. This is the olfactory nerve. I know it says olfactory tract and olfactory bulb. I want you to be familiar that this structure is part of the olfactory nerve, which is cranial nerve number 1. And then right here is cranial nerve number 2, which is the optic nerve. And what's unique about the optic nerve, let's make this blue, is that part of this is going to cross over to this side of the brain, and this one is going to cross over to this side of the brain, both ending up somewhere in that occipital lobe, which is the visual center. But when you learn the eye in lecture, they'll divide the eye in half, and let's say here's the nose, right? So they'll say that part of the eye, part of the visual input that's coming into the eye stays on the same side of the brain, and some information crosses over to the other side, okay? So information that's coming in, some information comes in from the temporal view is gonna kind of come in this direction, and then some information crosses in this direction, right? And they're going to converge and then they crisscross. So, and some information is going to stay on the same side of the brain. Okay, so where the information crisscrosses, the key to this is that some information from the right eye stays on the right side of the brain, but some of it crosses to the left. And then some information from the left eye stays on the left side of the brain, and some crosses to the right side of the brain. Where it crisscrosses right here, where that X is, they call the optic chiasm. Forget about the A. Just call it the optic chiasm. That's where they crisscross. And this structure right here is the pituitary gland. So some people that have pituitary gland tumors, when this thing enlarges, you can understand why some people experience visual disturbances, because it can enlarge and put pressure on part of the optic nerve. And this is when the individual would see a neurologist and they would say, do you see my look straight ahead? Do you see my finger wiggling? They may say, no, 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 until it's right in front of them. And that kind of gives them clues as to what part of the optic nerve is being compressed or being blocked. So here are the 12 cranial nerves. So cranial nerve 1 is the olfactory, and then cranial nerve 2 is the optic. Cranial nerve 3 is the oculomotor. Cranial nerve 4 is the trochlear. 5 is the trigeminal. 6 is the abducens. 7 is called facial. 8 is called vestibulo cochlear. Looks like it's 2 nerves in one. 11 is glossopharyngeal. Glosso means tongue. Pharyngeal is from pharynx. Cranial nerve 10, vagus nerve. Vagal means vagrant or wanderer. 11, accessory. And cranial nerve 12, hypoglossal. So you should know the Roman numeral and you should know their names. Now, this column here off to the right is telling you whether the cranial nerve has sensory function, whether it has motor function, or whether it has B for both, mixed, sensory and motor. So the little mnemonic to remember that, some say marry money, but my big brother says big brains matter most. So when you take the first letter of each, it kind of tells you whether it's sensory, motor, or both. Okay, now you can kind of memorize that silly mnemonic. The one that I remembered was some say marry money, but my big brother says big business marries money. So whichever you want, you can play that back and see which one suits you best. How do you remember the ways of remembering the 12 pairs of cranial nerves? What works for me and for my students, I've taught them O, to touch and feel, very good velvet, ah, right? So O, olfactory, optic, oculomotor. To touch and feel, 4 is trochlear, 5 is trigeminal, 6 is abducens, 7 is facial, very good velvet, 8 is vestibulo cochlear, 9 is glossopharyngeal, 10 is vagus, and then 11 and 12, 11, when you say ah, is the accessory or spinal accessory. That's for 11 and 12. Let's make sure you're clear about that. And then 12 is hypoglossal. So you just basically are taking the first letter of each and then matching it up with the cranial nerves. Okay, so then you can go back and review. Okay, but this is the one that many of my students use. O, to touch and feel, very good velvet. Ah, just remember ah is AH for 11 and 12. Now here's just a little diagram showing you the 12 pairs of cranial nerves. I won't ask you all of these cranial nerves in terms of off of the brain. I think knowing, for me, I'm happy if you can see the obvious ones right off the top. If you could see the olfactory, which is cranial nerve 1 for the sense of smell. If you can see the optic for cranial nerve 2. And then right here in the center is the optic chiasm, where the optic nerves crisscross. And then here is your pituitary gland. Okay. Now, it is important to know their functions, okay, and primarily what they innervate, what they go to. So cranial nerve 1, you can test this by testing someone's ability to smell something, right? So when I test this, if there's ever a TBI or traumatic brain injury in my office, I would hold something under their nose, like lemon or vanilla or lavender, and ask, can you smell anything? Their mouth should be closed. They inhale, they breathe in. If they can identify it, then I know the olfactory nerve is working. And then the optic nerve is cranial nerve number 2. Cranial nerve number 2 allows you to see. Cranial nerve 2 has the receptors for vision. So if you can see something, that's great. And then being able to identify what you see tells you that the messages are getting to the brain, right? Do you see my fingers? Yes. How many fingers am I holding? 2. Perfect. Now we know the visual center is working and the association area is also working. Now, cranials 1 and 2, these originate in the cerebrum. Okay, so if we were to say, let's see if I can do this. Let me go up one here. Let's say we have the medulla, the pons, the midbrain, and then we have the cerebrum. So here we have cranial nerves 8 through 12. Here we have cranial nerves 5 through 7. Here we have cranial nerve 3 and 4. And here we have cranial nerve 1 and 2. So in the medulla oblongata, the nuclei for cranial nerves 8 through 12, remember you would need to know them this way, right? 8 through 12. Those originate in medulla. In the pons, you have cranial nerves 5 through 7. And then in the midbrain, we have cranial nerves 3 and 4. And then in the cerebrum is cranial nerve 1 and cranial nerve 2. This is important because when we test cranial nerves or people have malfunction to them, it tells us perhaps what part of the brain there could be damage to. Not just the cranial nerve that's not functioning, but the part of the brain that may be damaged. Okay, so you have medulla, pons, midbrain, and then the cerebrum. So that's cranial nerve 1, cranial nerve 2. Okay, cranial nerve 3 is the oculomotor. And you'll see that 3, 4, and 6 get grouped together because they're all responsible for moving the eye in different directions. Okay, and a little mnemonic to help you understand which cranial nerves go to which eye muscles. It is LR6, SO4, all over 3. So it's a like Lindner's chemical equation. What does Lindner's chemical equation tell us? LR6, SO4 all over 3, or if you want to do it SO4, LR6 all over 3, it's telling us that the 6th cranial nerve goes to the lateral rectus muscle, and the 4th cranial nerve goes to the superior oblique muscle of the eye. And then all over 3 tells us all other eye muscles are innervated by cranial nerve number 3. So lateral rectus is innervated by the abducens nerve, superior oblique by the trochlear nerve, and then the other 4 eye muscles are innervated by the oculomotor, which is cranial nerve 3. Okay, so SO4, LR6 all over 3 tells you which cranial nerve goes to which muscles to move the eye. So that's 3, 4, 6. Where is our cranial nerve 5? Where's the face? Where is that? Here it is. Trigeminal, cranial nerve 5. This is the only cranial nerve that has a dermatome. So dermatomes are dealing with like a neurological mapping of sensation. And the trigeminal nerve deals with sensation to these 3 parts of the face. Trigeminal nerve is cranial nerve 5, we call it V. So we have V1, V2, and then we have V3. 3 different parts of the trigeminal, which is why it's called trigeminal, because there's V1, V2, V3. V1 deals with the ophthalmic part of the eye of the face, And then V2 deals with the maxillary part of the face. And then V3 deals with the mandibular part of the face. And this is the cranial nerve that when you go to the dentist, they'll need to hit with Novocaine to numb half your face and half of your tongue goes numb. It's the trigeminal nerve that they want to numb so they can work on your teeth without you feeling it. Cranial nerve 5 not only deals with sensation, but it deals with the muscles of chewing, the muscles of mastication. They allows you to chew. So trigeminal nerve is both sensory and motor. Sensory to the face, motor to the muscles of mastication or chewing muscles. Okay, so you see here sensory and we see motor. Okay, where is 7? Cranial nerve 7, the facial nerve, deals with the muscles of facial expression, like smiling, frowning, raising your eyebrow, whistling, puffing out your cheeks. All of those are facial nerve, cranial nerve 7. Cranial nerve number 7, facial nerve. When this one's affected, people get Bell's palsy, which is facial paralysis. You get like drooping of half the face. That's facial palsy or Bell's palsy. Okay, cranial nerve number 8. Now we're up here right around the 2 o'clock position. Cranial nerve 8 is vestibulo cochlear. And when you look at it, it's 2 words, vestibulo and cochlear. This is the vestibular portion. This is the cochlear portion. So it's one cranial nerve that goes to 2 parts of the ear. And when I cover the ear in another video, we'll review that again. The vestibular portion, I'll put a B here, deals with balance. And then the cochlear portion, I'll put an H for hearing. So the ear is responsible for balance and hearing. Many people end up with vertigo, or they have benign paroxysmal positional vertigo, which is when a patient may tell you every time they roll over in bed to the right, they get dizzy, or if they turn their head to the right, they get dizzy, or when they go to the barber or beauty salon and their head is hanging over the sink, they get lightheaded and dizzy, or going from lying down to sitting up, everything spins. This is when there's an issue with the vestibular canals inside the ear, and it's treatable, it's manageable. People suffer with this for years. I can pretty much fix a benign paroxysmal positional vertigo in probably 6 or 7 minutes or under in my office. I do many of these throughout the year without drugs or surgery. The cochlear deals with hearing. So that's cranial nerve number 8. Cranial nerve number 9 is the vestibulo cochlear. It does sensory and motor. Cranial nerve 9 deals with the gag reflex. Like when the doctor tells you to say ah, and they touch the back of your throat and it closes up like the gag reflex. That's cranial nerve 9 for the sensory. And the motor deals with the muscles of the back of the throat. So sensory for the gag reflex, and motor, it makes the muscles contract. Cranial nerve 9 also deals with the taste of bitter. We'll put bitter to the posterior 1/3 of the tongue. Whereas cranial nerve 7 over here did sweet, sour, and salty to the anterior 2/3 of the tongue. So cranial nerve 7 does sweet, sour, salty to the anterior 2/3 of the tongue, but cranial nerve 9 does the taste of bitter to the posterior 1/3 of the tongue. Cranial nerve 10, which is the vagal nerve, really important nerve. When you look, this is probably my favorite cranial nerve. As a doctor of chiropractic, what I love about it is that this cranial nerve is protected here by the top vertebrae, which is C1 vertebrae. And by making an adjustment, we can influence that 10th cranial nerve that can affect so much. If we look at it, it can affect the lungs, it can affect the heart, the stomach, the intestines, digestion. It affects the entire pretty much gastrointestinal tract, lungs, heart, stomach, everything. So it's called vagus because the word vagus or vagal means vagrant. Like this nerve wanders to 90% of the human body. It wanders to about 90% and makes up also 90% of the parasympathetic. So your parasympathetic is cranial nerve 3, 7, 9, and 10. These are the parasympathetic cranial nerves, parasympathetic, cranial nerve 3, 7, 9, and 10. Remember, the parasympathetics are rest and digest, or feed and breed. And the sympathetic, the parasympathetic is called the craniosacral outflow. The reason being is this is the cranial division, craniosacral. The sacral division is S2, S3, and S4. So S2 to S4 of the sacrum is the sacral division of the parasympathetics. So craniosacral outflow. Sympathetics was called thoracolumbar outflow because it goes T1 to L2. T1 to L2 is the sympathetics. Okay, accessory or spinal accessory, cranial nerve 11, that deals with the sternocleidomastoid muscle and the upper trapezius. And then cranial nerve 12, the hypoglossal, deals with the muscles of the tongue, movement of the tongue. Okay, so those are the 12 pairs of cranial nerves. And on this picture, again, it's just showing you the name as well as Roman numeral. Be familiar with them. It tells you the sensory, motor, and PS is parasympathetic. So parasympathetic is 3, 7, 9, and 10. Those are the parasympathetic fibers. Okay. Okay, good place to take a break. When we come back, we'll get into the eye.